And we'd like to thank Desert Financial Credit Union for sponsoring our KRIM Community Spotlight program. Good morning, RIM Country. Happy Wednesday. Hump Day. I was trying to think, what day is it? And I had to think back to yesterday being Taco Tuesday, and so it has to be Wednesday. In the studio this morning, I have Hoyt Skabelund, CEO of Banner Payson Medical Center. Good morning, Hoyt.
Good morning, Chris. Thank you for having me.
Oh, you are so welcome. And we're going to be talking to Hoyt today to find out what's happening at Banner Payson Medical Center, new programs, new doctors, just things that are taking place at Banner, because it seems like you guys are always improving or always getting better.
We're trying to.
You're great, but I love organizations, businesses that are always striving to improve what they do, their service, their programs, offering more, to the community, and Banner does a wonderful job of that.
It's kind of like dieting. You're never done. You know what I mean? The minute you think you've arrived, if you cease all the things that have made you successful to that point, then you will quickly erode. And we know we're not perfect. We have much room to improve, and we're always seeking to do that. We're dealing with human lives, and so perfection's the goal. And I don't know of any entity yet that's perfect, and or will be. There's only been one that I know of, and
yes,
walk this earth.
Lord and Savior.
Amen.
Thank you. Yes.
So, yeah, thank you. I appreciate that. I'm glad that you recognize we're striving every day.
No, it is very evident because of the various guests that you bring on, new hires to Banner, surgeons, different specialists, oncologists, pain management specialists. It is. And hopefully people recognize the amount of programs or everything that is offered by Banner Payson Medical Center in Payson, a town of 16,000, and I know where you serve all the surrounding communities as well, but northern Gila County, basically, roughly 25,000.
We've considered that our primary service area.
Yeah.
Tano Basin, Happy Jack.
Yeah.
Heber, nearly to Heber.
For all of the services that are provided for a community of 25,000 people, it's amazing.
It's great. We're doing so well. I read a headline last week, and then I saw the same headline again in the Becker's report. Becker's is a healthcare syndicate that's one of the most reliable, that you can trust the information is being founded in truth typically. And the headline was 419 rural hospitals in danger of closing or closing programs. Boy, that got my attention. When you think there's only roughly 4,400 hospitals of all sizes in the nation, give or take, and probably less than half of those are rural. So let's just assume 2,000 rural hospitals and there's probably less than that, maybe 1,800, but 419 in serious trouble needing to close programs. And one of the most commonly closed programs that we're seeing creating what is being called as an OB desert, an obstetrics care desert, is in rural settings, is the closure of women's services relating to delivering babies. And that, I'm so grateful that I work for Banner Health, and I'm grateful that my prior career with Presbyterian Healthcare Services, both of these healthcare companies that operate rural hospitals, never considered closing obstetric services. It just seems like that's how hospitals began. The history here in Payson.
Exactly.
1951. I was in, my daughter and son-in-law lived in Duncan, Arizona. He works in the Border Patrol, commutes to Lordsburg, New Mexico. And in Duncan, there's one of these original homes that has a sign, the Women's Club of Duncan. Well, I was reading the history of our hospital here and reading through the histories available. The Women's Club National Association in the early 50s, may have been for decades, I don't know the history on either side, was very formal and organized across all of the states in the Union. And here in Payson, that women's club was ages 18 and older. Well, a group of those, remember the population of Payson and Strawberry Pine area was less than 1,000 people at the time, between all three communities. There was a group of young women ages 18 to 30 who formed the Junior Women's Club. And the reason, and the articles I'm reading, if they're accurate, the reason that they formed the Junior Women's Club was expressly to recruit a doctor to deliver babies in Rim Country.
Wow.
So they didn't, that was the reason that they created the Junior Women's Club.
Wow. It's unfortunate, I want to say it's ironic, but also more unfortunate that, you pointed out in Duncan, and I'm sure it's like this in most rural areas where a clinic or a hospital was founded. Most likely it was women that were the major force behind that. And then to get to a point where those rural hospitals or medical facilities are struggling, the first thing they cut are women's programs.
It's a real concern nationally.
I'm thinking, wait a second, if it wasn't for women...
We're degrading, we're going the wrong direction. I'm glad we're not in that boat. I'm grateful for those Junior Women's Club here, those members, probably 30 members or less, who raised $11,000 cash on a population of 1,000. And Miss Pyle was one. She was an heiress, one of the, I think to this day, the most generous woman in Payson's history. She raised many thousands of dollars from the ranchers in the area, and she had volunteered as a member of that club. And they did recruit the first doctor once they built the clinic. The Valley Bank of Arizona was the only bank in the state of Arizona willing to create a loan of $20,000, which was paid back in full. But when that president of the bank said, let's take a chance on this remote town Junior Women's Club, let's take a chance on them, I'm not sure he had any intention of being paid in full in return, but he was.
Wow.
And so they did rebuild the clinic, delivered the first baby with the first doctor. They did have some doctor turnover. That's always a challenge in rurals. And then every 5 years from then, they added on overnight beds until the 1996. The hospital took out a loan, I think it was about $15 million to build what we see where all the patient care is provided today. And now we use the old hospital that was prior to that for administrative offices and conference rooms. But then that led to, that debt became very challenging. And that's when the determination was made to look to invite a health system partner, and Banner came, and we were just thrilled to be part of this community. So long story to say, we're doing well in comparison to a large percentage of rural hospitals in this country. And
yes.
I'm rurally minded. I'm cheering for those hospitals that they can find a way to survive and move forward. And I'm grateful for the representatives and the senators in Washington, D.C. representing these rural settings, and hoping that they'll be successful in finding ways to preserve the critical infrastructure of healthcare in rural settings.
Well, and you mentioned community, and I know that is a big part of your mission, is serving the community in a medical capacity, but also supporting the community as well as a organization within the community, and that is very evident. I know went to watch some basketball games. Our youngest son Noah, that you play basketball with some Saturday mornings, and he plays basketball for the high school and the floor, Banner Payson Medical Center.
We're so grateful that we had the chance to help when the floor needed to be redone, and that was an ask. I know there are others that would have done that. We know we don't stand alone in our support of the schools, but we're grateful we could give back. Patients, there's a poll in research, and let's assume that it's accurate. 90% of patients or citizens, let's say, in the country trust their healthcare physician or provider. But less than 50% trust healthcare organizations. So if you're my doctor, I trust you,
Yes.
but I don't trust who you work for.
Gotcha.
And that wasn't the case 10 years ago, but
Mhm.
now in the change in society, these last 10 years, the pandemic, et cetera, I think just establishments we've lost, and there's been reasons there's been some businesses and organizations that have done terrible things and have been caught, and it becomes public, and now you wonder who you can trust. So I think it's important, my comment to make that, state that those facts, assuming that they're accurate, that it's important for us as an organization, Banner Health and Payson and Rim Country, to be a good corporate citizen of this community, and to give back where we can. And we our margin, we made a 4% margin in 2023, which I am tickled about, although that's just on the edge of being sustainable. But we're tickled. Many people would not operate a private business at a 4% margin. Most businesses seek to make a 20% margin as a minimum. That's typically a floor. We're a not-for-profit, despite the image that we do have large hospitals in the valley, and we're grateful we have Banner Desert and Banner University, where we can send our most critical patients once we've stabilized them. I'm proud of Banner Health, and the healthcare we provide, and I'm grateful to be part of a not-for-profit health system where we don't pay stockholders. We generate money to reinvest in the community. We're planning to make substantial investments here in the next year. You'll start to see visible changes, which you haven't seen yet.
Yeah, and I think one of the big differences with a rural hospital like Banner here in Payson, the longer you're in the community, you get to know people that work at the hospital. You get to know nurses, doctors, people that work in the kitchen, making food, serving food. But you get to know them because maybe your kids play sports together, or you go to church together, or you see each other at the park, walking around Green Valley Lake, and you have relationships. You can build relationships. So when you go to the hospital, I know that to me is comforting. When I go, if I have to go into Banner, whether emergency room or for an appointment or whatever it is, to see friendly, familiar faces. Yeah. Where in a metropolitan area, you don't have that. You don't have those relationships where those doctors and nurses and everyone in there, they care about their patients and care about what they're doing and will do their best to serve you. But it's just different when you see a friendly, smiling face that you know.
I love rural America. I probably moved almost as much as, well, in some cases as often as military folks have moved within companies. Rural's mostly been a turnaround, go and help rural hospitals get stable. That's not the intention here. We hope to retire here. We have no aspirations for bigger.
Yeah.
I've done that. I'm happy where we're at, and I want to make a difference, and that's why I chose healthcare. I love the familiarity, the intimacy of knowing one another, and I love the accountability it brings. I grew up in a small town and small high school, and you do something right, it's remembered for a week. You do something wrong, it's going to follow you for a year. Yeah. I don't mind that. I've loved raising our children in rural settings, and the people say, "Oh, there's so many disadvantages." I'm not sure that there are differences, but there are positive differences, and there are some that are inconvenient, and there's inconveniences, and sometimes limitations. But I'll take those limitations. I'm grateful for Linda Gibson, the school board, the efforts they're going through. I'm devastated that we didn't pass a tax to sustain the tax. I don't understand how we as Americans can turn our backs on the next generation that, by the way, will be the physicians caring for you in the ER. And you're going to save $100 on taxes. It'll be returned to you. Yeah. I sure hope that we can remember how good we have had it and that we can give back.
Mhm. And you look at the high school and just recently receiving that A, the grade, A, for their performance. So they're doing a great job. And as you said earlier, they're not perfect. They're not perfect.
No.
They know there's areas where they need to improve, that they need to focus on. It's a daily challenge.
It is a
I mean, it's
challenge.
something that we're constantly doing.
And I would, just Hoyt's little, all of my opinions are free, there's no refunds, you get what you pay for, But I would just say this, my dad served on the school board, and I remember being disappointed that he did, because that came back on me. One time I remember telling him back, Dad, why are you doing this? You're embarrassing me, you're unpopular in your decisions. And he said, I remember a sober look overcame him, and he quieted down, and I knew that I had struck a chord, and that it wasn't feeling good. And that, I was a teenager, but I never want to be disrespectful. And he said, Hoyt, the only reason I'm on the school board is for you and your sister and your brothers. If you really want me to resign, I will. Of course, in a discussion, I didn't, I said, no, I don't, anyway, but that left an impression on me. And my dad said he always came to our classroom every year. And I said, why did you come to school today? He says, I've learned that if I just introduce myself to your teacher, let them know that I want them to hold you to high standards, and that I expect you to be obedient and respectful, and if that isn't happening, to call me. And if they're worried that you're not putting your best effort in the classroom, they let me know, I'll take care of it. And so he would show up, and they never denied access. And just 10 minutes, 5 minutes at the back of the room, kind of look at the floor, because you're trying to be cool, and your dad's in the background, what's going on? What'd you do, Hoyt, to get in trouble, And my mom was in the school, she was a teacher's aide. I think that rural settings where there is one school is a disadvantage for administrators of that school, because you take all comers, parents that don't care and aren't engaged. You still have those kids in that classroom, and you care deeply about those kids and the kids whose parents care. So those who criticize teachers and administration, I would say the first finger ought to point back at you. What are you doing to help? Are you hosting a Saturday morning basketball so that you can have a positive influence on kids? I'm just so tired of the animosity and the criticism that's become so popular. Are you just speaking about it is not enough. What are you doing about it when no one is listening and when no one is watching and aware? Who are you in the dark? Who are you when the lights turn off at night? Who are you that only you and God know who you are? That's what we should be focusing on, is who are we individually and how are we making a difference? And I think to part with $100 of property taxes that we've been parting with for and not everyone's $100, it might be $50 or 25, but whatever that average, I read that in an article. I think, come on. This is America. We have ancestors who gave their lives that we could have this step up we've had. Are we not willing to give a little? And if it pinches and hurts, and I know that I make better money than the average, but I would like to believe that I would give of my time, which we all have the same amount, and money to give back to those that have sacrificed to give so much to the community. So, boy, I'm on a soapbox today, but I'm passionate about doing what's right, and I love rural America, and I love Payson, and I love this urban country, and I think it can get better, like we're trying to do, or it can get worse. Inaction is an action. Being neutral and saying nothing and doing nothing is an action. It's really a vote in opposition. So I hope that the good people that listen to your program, and I'm sure the vast majority are doers, not hearers only, but doers, and I hope we'll just all do little things. This morning, walking my dog, I always bring my plastic shopping bag with me, the throwaway recycle, because I've found there's always a piece of trash on my walk, and it takes me one more second to pick it up. When I'm done with my walk, almost always I'm amazed that it's a little bit heavy. Whether it's a 30-minute walk, I'm like, wow, if we all did this,
Yeah, and I think that, I know participating with Keep Payson Clean.
Yeah.
That inspired me as well, to where I find myself doing that around Green Valley Park, walking around the lakes or the park, and I see a piece of trash. I just can't walk by it now.
Me too.
I need to pick it up, because I think of those times where we go out, and Jesse and all the other members, Keep Payson Clean, and just the difference it's made, the impact it's had on our community. It has been noticeable. So
And that
it's great
vision
to see that.
to be the cleanest town in America. I
There
just
you go.
love Jesse, because I
Yeah.
think it does change your behavior.
Yeah.
I walk by a cigarette butt. It's the most common thing to walk by, and I thought I say, you know what, I
Yeah.
can do that.
So it's funny, I know most of our kids' teachers, they have my cell phone number, and there's been instances where and I've told them all, you can say that. Say, hey, if you continue to behave this way, I'm gonna call your dad. And they're like, and they used to say, you don't have his number. And they would just pull up their contacts and show
the
them,
phone number.
and then their reaction, oh, okay.
Yeah.
But it's great. Well, if you're just tuning in or just watching on our KRIM radio Facebook live, talking with Hoyt Skabelund, the CEO of Banner Payson Medical Center. And it's as far as, I love how you've mentioned quite a few times now as you've come on over the years, wanting feedback from patients, wanting feedback from people that Banner Payson Medical Center serves. And I think that's great to want to hear that, because that allows you to improve.
An example, thank you, an example, we have our text the CEO,
Mm-hmm.
and there's a sign in the hospital, so that, in that moment of irritation,
Mm-hmm.
it's easy to text so that you don't forget, or
Mhm.
that it's intended to try to get the raw feedback. And I appreciate a text we received during one of our most recent snowstorms,
Mm-hmm.
where it just seemed to keep snowing, and then it's raining, and then snowing,
Yes.
and then it froze
Mhm.
that night. So it was slushy, and then it froze.
Ice. Yeah.
And our parking lot design is one of the areas we're gonna be investing in. We need to change some of the grades, and changing asphalt is very expensive.
Oh,
You
yes.
have to tear it up, and then to regrade it with granite,
Mhm.
all the granite we all deal with, it's just expensive, and the cost of everything, all of us know this,
Yes.
has at least 20 to 40%
Mhm.
increase, in some things more. So our parking lot was not as clean as we'd like. We were busy, so there's cars parking, so you can't really get in to scrape it. And to get a shovel between cars, you can't take a chance of scraping the side of a car, so it really wasn't a practical way. The CEO message was, really, Hoyt? Is this the best you can do with the condition of the parking lot? And man, it was true.
Gut punch.
But it was, just one of those where you're like, you turn red and
Yeah.
blush and you're embarrassed, and tried to text this individual back. They weren't interested in having a follow-up conversation,
Yeah.
never replied. But we had a conversation with facilities and said, what can we do? And it certainly is gonna influence the redesign of the parking lot, where the cement curbs are, so we can more easily get a blade through quickly when, try to rope off a parking lot's hard. Parking lot's a little undersized already. So that's an example of how rock, it's simple, but we don't want someone to have a precarious experience from their car to the front entrance of the hospital.
Wow.
However, during inclement weather,
Yeah.
it's a challenge in every hospital. I'm from snowy country, much snowier than Payson, and
Yeah.
it's a challenge in every hospital, but that's the kind of feedback we want.
Mhm.
If that individual's listening, then know that I appreciate that feedback. It was real time, and we did go out and try to clean up. We had ice melted. Problem was, ice melt will freeze. It lowers the freezing temperature, or I'm saying this right? But it's not unfreezable. You know what I mean? And then you have water. You can have that layer underneath with ice on top of it. And
Well, when it's really cold, I've seen where, ice melt, you put it on the ice and it just starts melting into it a little bit, pockets.
Yeah.
But
it doesn't get removed.
Yeah.
We couldn't get some of that ice removed. I think you all know this when you're on driveways, and there's certain things you just can't remove, and we don't have heated drive. And, I've never had a heated drive. I'd always be curious to have one, but I don't want to pay for that electric bill. But
no.
anyways, that's an example. So we do always want feedback. If there's any listeners listening, and you have a concern, or you know of a neighbor who's concerned, the easiest number, my office number, because that way you'll get my assistant's voicemail or her answer. She's fabulous at taking concerns and complaints. But that number is 928-471-1200. And you can call, and we want to hear. We don't want to disappoint, but if we've already disappointed, we want to learn about it.
Yes.
And don't assume that we know. I often say, well, I'm sure you know. I said, no, I didn't. And so some of the best gifts are when we're rounding on patients that are staying overnight, rounding on a patient in the ER. That means we visit them, talk to them, ask them a series of questions. Some of the best and simple improvements we could act on quickly come from patients. And it's humbling and how simple sometimes the feedback is. That we don't know. We're like, we didn't know that. Thank you.
And another area I just wanted to mention, and this is connected to smiling faces, or is part of that, are your volunteers. And I know the one in the emergency room, Ken,
Ken's fabulous.
Ken, and others that have been on the radio, but that makes a big difference as well.
I think when volunteers are there, they're giving a portion of what we all have the same of in terms of time. We don't know how long we'll be on the earth, so I suppose we have different varying, but they're often retired, the vast majority, and twilight years in many ways, and they're giving a portion of those. There's just something that elicits naturally trust. And there's something about a grandparent or a grandparent-aged person greeting you at the front door. We're grateful for that, but we sure appreciate the chance to visit with you and your listeners every month. We have some, we're trying to line up physician schedules with the third Wednesday, but we would like to talk to you in the future about our new physician training program that has become accredited. It's our family medicine residency program.
Nice.
Bring Dr. Matern, she's our program director, and talk a lot about that. We're grateful to the MHA Foundation for their partnership with the University of Arizona and Banner University and Banner Medical Group to help lay the groundwork over the last 4 to 8 years on that. And, so we're excited about that, and hoping to bring our orthopedic surgeons to come on the program. Dr. Sepich, Dr. Manning, when their schedules line up, it might be in the next 12 months at some point. And then we've got new doctors arriving later this year, Dr. Crandall, who graduated high school in Heber, and then another doctor who grew up in the Valley, but his grandparents live up here. And then hopefully a third doctor who will join us next year. So we're constantly recruiting. We are in the final stage of hopefully recruiting an oncologist to join Jody Strand on boots on the ground. I'm hoping to learn more about that in the next week. There are ups and downs, but we hope to personalize who we are and have physicians talk with you and your listeners more. So you got stuck with me today in my little soliloquies and my philosophies.
No, that's great. And wow, Heber. So he was a Muggy-on Mustang.
He was.
Wow.
And so he called us and said, you have an opening. I grew up near you. I'd like to come and spend my entire career there. And that's the kind of doctor we're looking for, these Dr. Scoutons and these Dr. Vandruffs, these doctors that have been here for a long time, the Dr. Cloughs, the Dr. Munozes that spend decades here. And not all doctors can predict their whole life and be able to offer that. But when we are able to find those that have that intention, that's a gold nugget.
Oh, yes. And something, when you mentioned all the different organizations you're working with, it is about collaborating and collaborations, partnerships these days. That's how you get things done.
Payson Christian Clinic is an example, and all the different not-for-profit organizations in this community, Chamber of Commerce, the town, the county. I wish we had time to give some to illustrate how much we work together, how often we depend on each other, and what a difference it makes in some cases where you think, wow, what would we do without
this entity,
the Humane Society, to help care for the animal of this patient who has no family to care for that animal? You know, just little things like that.
Oh yeah, no. Well, thank you so much for coming in. That's all the time we have for today. Time to get back to the music with some David Bowie, Rush, Rolling Stones, and more. But first, let's get a quick update from the National Weather Service. And thank you again, Hoyt.
Thank you.
All right, see you guys.